What should I do if my child is poorly? Most of the illnesses that we're seeing at the moment in children and young babies are upper respiratory tract infections, and these are spreading because as lockdown eases and more of us come into contact with each other, we'll end up having more sore ears, runny noses and coughs coming on, along with temperatures and sore throats, which leads to decreased feeding. The first thing you should do for your baby is to get some paracetamol or some ibuprofen into them. Keep them hydrated and see how they are. What should I do if my child has a really high temperature? Really high temperature is a sign that your child's body is fighting the infection well. It's essential for us to be able to mount a temperature response to an infection. You can gauge how well your child's going to be by giving them some paracetamol or some ibuprofen and seeing how well they respond to it. Don't worry about the temperature in itself. You need the temperature to be able to fight the infection. What you need to think about is how well your child actually is, whether they're drowsy, how responsive they are, whether they're able to take on board fluids, and whether they're able to smile. If you're worried still after this stage, then you can take your child to be seen at the urgent care centre or get in touch with your general practitioner. Pharmacists are trained in being able to assess minor illnesses and ailments, and you can seek their advice as well. So when should I bring my child down to the emergency department? Well, there's no hard and fast rule to this one. If your child's alert, running around, bright and happy, even if they've got a temperature, then they're probably going to be fine. If your child, however, is drowsy, floppy, not responding to you, you need to be seen in the emergency department after you've given some ibuprofen or some paracetamol. If your child has developed a rash that doesn't go away, the spots that don't go away after you roll a glass on them and you can see the spots underneath, then they need to be seen in the emergency department. If your child is irritable, crying despite you giving them some medicine and giving them cuddles, and you can't calm them down, then bring them to us and we'll see them. And the other thing I've learned in experience is when you've got colour change, such as going blue around the lips, or when your hands and feet are going ice cold and you can feel the cold line going up the hands and up the legs, it's definitely a time you need to be checked out in the emergency department. One thing parents always say is that I didn't want to mask the temperature by giving ibuprofen or paracetamol. If your child's not allergic to any of those things, there's absolutely no reason you shouldn't give them a dose of paracetamol before coming to the emergency department, as it makes assessment much easier. So where can I take my child if they are poorly? Well, as I'm sure many of you will have heard, emergency departments across the country are busier than we've ever been. Other places you might consider are your general practitioner. You could try NHS 111, who'll be able to give you further advice. And your pharmacist is actually trained in recognising and managing minor illness, so you could try them. The walk-in centres are open, as are the urgent care centres at Halton and Widnes. Think carefully before you come to the emergency department and be prepared in case there's a bit of a wait.